Rises often with little warning for families across the country. One day, you're a daughter or a son. The next, you're a nurse, a lifeline. Thanks for sticking with us. It's On Your Side tonight at 7:30. I'm Jamie Bowl.
And I'm Kim Anderson. Across North Carolina, growing numbers of families are finding themselves in that role.
It's an absolute crisis out there in the field. Over 2 million North Carolinians right now are family caregiving more than 15 hours a week.
And it's not just North Carolina. Nationwide, nearly 60 million people are caring for an aging loved one, often while holding down full-time jobs and raising families of their own. And much of that care centers around one diagnosis.
If you are lucky enough to live to 80, your probability of getting dementia goes up to 33%. And, we are now just hitting a wave in our society where the oldest of the baby boomers, post-World War II, 1946, we just hit 2026. So the large wave in our population of people who are turning 80 and as a result getting dementia and needing a lot of care is growing very fast. In our state, dementia is expected to go up over 50% in the next 5 years.
Well, that is Neil Shaw, CEO of CareyAya, a senior care at home company. He knows all too well how the burden of taking care of aging parents falls hardest on adult children. He's lived it himself twice. He spoke with us about the mental, physical, and financial stress families go through and how it drove him to create a company that offers relief to families and education to students.
A family caregiver for an older parent with dementia spends 21 hours a week doing unpaid care. The cumulative cost of that care in our country is $870 billion. This is just free labor people are doing. And I think it's resulting in a lot of middle-aged people burning out, a lot of people having to quit their careers, or having to blow through all their savings to find care support. 1 in 4 caregivers within 1 year of doing caregiving, for aging parent reports mental health strain. And 1 in 3 reports an impact on their own physical health.
Neil Shaw was one of those unpaid caregivers.
I went through it twice, actually. I previously had another career, and in my early 30s, I became a caregiver for the first time in my life, going through my grandfather's dementia care. After he passed, I became the primary caregiver for my wife, 3 years of cancer care.
That experience led him to create CareyAya, a North Carolina-based program connecting healthcare students with families that need help caring for loved ones at home. It's non-medical care, things families often handle themselves, while providing college students real-world experience.
Preparation of meals, taking somebody for a walk, helping somebody go to the bathroom, kind of keeping them safe at home, keeping them company at home so that they're safe and don't, kind of wander off. So we run it completely social impact, no fees or markups, completely free to use, and then you pay the student on average $17 an hour. So it's a great opportunity for students to get flexible part-time experience helping people in their community. By the way, these students are exceptional. That's the best part of the program. These are our future nurses, physician assistants, etc.
At a time when many families say they're choosing between paying for care or quitting their jobs altogether, a program like this is beneficial, and it is growing quickly with more than 5,000 students in North Carolina alone.
The coolest part of the program is the intergenerational relationships. Thousands of 20-year-olds are now interacting with thousands of 80-year-olds.
A beneficial program indeed, but healthcare experts say it's going to take even more to solve this aging care crisis. As the population ages and the cost of care continues to rise, families across the Carolinas are facing hard choices.